Hello, I'm Dr. Kim, plastic surgeon from Gangnam, Korea. Today, I'd like to share my experience about my new injection technique with Restylane Vital. The keyword are dermal hydration and dermal injection. I use Restylane Vital for dermal hydration. According to the manual of company, we can inject microdroplet into dummies with 1 cm apart. However, how much amount is the microdroplet and how long distance is the optimal spacing? Here is the wonderful paper about Vital by Dr. Williams. However, conventional way has some unclear issue. Dr. Williams injected 20 points with 0.56 Vital into mid dummies. So, the amount of microdroplet was 0.025 cc. Here is her wonderful result, but I think it was mainly sub-dermal volume effect. So, I want to differentiate dermal change from the volume effect. I inject Vital into dummies on my hand with only 0.01 cc of Vital. Even though I inject less amount than her, lumps stay over 2 months. It was interesting. I think my depth of injection was more superficial than her. In order to avoid lumps, when dermal injection, we need to inject less amount with higher density and dilution. To dilute, I mixed 1 cc of Vital with 0.5 cc of lidocaine and 1.5 cc of normal saline. When you dye the paper, lighter concentration of ink is easier. For hydration, smaller particles are better. This is common way of injection, like using water gun. As you can see, we can distinguish easily the wet and dry part, like lumps. This is good for volume effect, but not good for dermal hydration. This is my technique for dermal hydration, like water spray. The paper gets wet evenly. This is good for hydration effect. There are two injection methods, broad needle and sharp needle technique. Broad needle is very useful, I like that, but we cannot inject into real dummies with it. We can inject into real dummies with the sharp needle. Now let's talk about the depth more seriously. I came from Korea. Korea is the only country that divided into two by 38 parallel. Have you ever been to 38 parallel? But that doesn't mean you enter North Korea. It is hard to enter and exit North Korea. Even if you are in there, it is limited to travel inside. Like hard to massage. Dummies is just like North Korea, hard to inject. I like to say sub-dermis is South Korea. Sub-dermis is composed with loose tissue, so it is easy to enter and travel, just like easy to inject and massage. Moreover, South Korea is common depth of pillar. I named injecting Vital on dummies as MESO-VITAL, whereas injecting on sub-dummies is sub-Vital. This is conventional injection method of Restylane Vital. It's very boring. Hard to patient, hard to doctor. Now you can use new revolutionized weapon. This is MESO-VITAL, made in Gangnam. Now let's take a look at the needle. As an octopus, the suction cup holds skin tightly and the skin stays away from the vessel. It has 5 needles, so 5 times faster. The arrow shows the suction flow. We can control the depths and dose easily. I inject on pig skin to see the depth. Depth of injection is controllable. With my setting, one shot will be 0.001 cc. I think microdroplet is less than 1 microliter. This is my technique use with an injector. I did 1,000 shots. Less bleeding spots show optimal depth. Many lumps mean you did a good job. The lumps would disappear after cold massage and compression. Assessment. I use microscope. I checked the electric resistance on dummies by needle. Dermal thickness was checked by ultrasound. The result. This is the result of MESO-VITAL. There was significant change on microscope. Dryness and roughness were improved. Here is the result of sub-dermal. There were many burning effects and with less hydration. So in case of hand, it was efficient to hide blood vessels and tendons, but it was not effective to improve skin texture or skin dryness. However, in case of thin skin, it was somehow effective as sub-dermal injection, so many European doctors confused about injection depths. Leg. Left side shows chronic dryness. Right is after. I did MESO-VITAL and dryness were improved. Upper left is before, right is after. Bottom picture are after 2 years. Left is 6 months. Right is after 2 years. As you can see, the landmark, these are exact the same spot. Now move on the hip. Upper is before. We can see the atrophic change on the hip. Many lumps was seen after MESO-VITAL. Dummies was second and looks healthier. Upper left is before, right is after. Below is after 2 years, still maintained. Now look at the hand. Different from Dr. Williams' study, I differentiate the depth of injection. I did both MESO-VITAL and sub-VITAL on the same patient. I did MESO-VITAL. It is safe to inject on the blood vessel because you shot on dummies. You can see the many lumps. There was no major bleeding even on the blood vessel. You can see the improvement of microscope. The same patient came back after 1 year, and this time I did MESO-VITAL. I did sub-VITAL. I injected only on right hand after 6 months. Blood vessel and tendon was still hidden. It was burning effect, not hydration effect. However, you can look at the bottom. There was no microscopic change. That means dryness was not improved by sub-VITAL. And the patient felt the same. This is sub-VITAL. This is 1 year ago, MESO-VITAL. You can do on any dry part of skin, elbow, neck. Finally, the finale, the face. This is a 65 years old female. I did MESO-VITAL. As you can see, wrinkle was surprisingly improved by only 1 session. The same patient. Skin looks much brighter, smooth, and sleek. Improvement of crowd fit. You Can you see the spreading of Restylane Vital from the injection site? This is a case of sub-vital. Sub-vital is good for volume effect, sub-dermal volume effect. In case of thin skin, sub-vital is not bad. I like that method. Sub-vital with fat remover, not bad. Body wrinkle on upper lip can be improved easily by MESO-VITAL. Fine wrinkle of thick skin can be improved by MESO-VITAL. Even skin pore can be treated by MESO-VITAL. For conclusion, it is hard to inject real microdroplet into real dermis without mesogun. MESO-VITAL works great to hydrate dry skin and change skin texture, whereas sub-vital is good for volume effect. Different depth create definitely different result. Different depth, different result. Thank you. I'm Dr. Kim from